It is 8:31 time for your TTO program this morning, and we have West River Health Services in this morning, and we're going to start off with Dr. Carrie Ranum right off the bat. Good morning.
Good morning. How are you?
I'm doing good.
Good.
We're here to talk about a couple of things, or are we just going to talk about the one thing, the whooping cough? What's the official name of it?
We're going to talk about pertussis or whooping cough, as most people know about it, just because there has been a huge increase in the last year of cases of whooping cough, not only in adolescents and adults, but also in infants also. And just a little bit of what pertussis or whooping cough is. It's a contagious bacterial disease that's caused by Bordetella pertussis. And that is something that's found in your respiratory, your mouth, your nose, and throat of an infected individual. The most serious people that potentially life-threatening complications happen in infants and young children, especially those who aren't fully vaccinated. Almost 50% of infants who end up with pertussis end up hospitalized, and there's lots of complications that can be associated with it. So.
Now, when the school shut down a couple Thursdays ago, was that had nothing to do with pertussis, right? This was a different... Okay.
That didn't have to deal with pertussis or whooping cough. That had probably to deal with the norovirus that dealt with the diarrhea and the vomiting disease that most people know with like cruise ships. It spreads really easy, the vomiting and diarrhea. So
exciting stuff there. Yeah, definitely. So, all right. Did you want to add to it?
I'm not so much about what pertussis is. We are definitely seeing it. It can happen at any age. I think one of the things to remember about pertussis is you are contagious for 21 days if you have it, if you're not treated. And so if you have the symptoms of pertussis, and maybe Dr. Carey can talk about that more.
I was just going to ask.
That you need to kind of come in, be tested. If we're suspicious, we'll treat you while we wait for test results. So she's going to talk a little bit more about those symptoms.
Okay, yeah, let's talk symptoms, because we might have somebody that goes and they're going to run up and say, I better get tested, right?
So it's kind of hard with pertussis. The early symptoms, usually the first week to 2 weeks, is your typical kind of runny nose, low-grade fever, a mild occasional cough. And sometimes with infants, it can be apnea symptoms, or those are when they pause in breathing patterns, so they stop breathing. Early stages is hard to diagnose right away with pertussis. It's that later stage that happens about 7 to 14 days later that most people know the traditional symptoms of pertussis. And that's your fits, your coughing fits. So those are your rapid coughs followed by that high-pitched whoop that if you Google or YouTube it, you can see what a fit looks like. Vomiting after your coughing fits or exhaustion after coughing fits are the big ones that you know of. So if you've been exposed to somebody with pertussis and you develop kind of that beginning cold-like symptoms, mild cough and fever, then you should be seen and tested right away.
Now, if you catch it soon enough, is there medicine out there, antibiotics to treat it?
Yep. So the number one treatment for it is antibiotics. Is azithromycin is the number one treatment for all age groups. If you have allergies to azithromycin, there's different antibiotics that can treat it.
Okay.
But the best way to prevent severe symptoms is to have your children immunized. And those are at the ages of immunizations where you get it, the kids get it at 2 months, 4 months, 6 months, 15 months, and then they get another one at what we consider like kindergarten shots at 4 to 5 year old age. And then adolescents, they get what we call a Tdap at that 11 or 12 year old age. So that's 6th or 7th grade. They get their Tdap booster. And then everyone should get their tetanus, and now we're recommending, the whooping cough part of it every 10 years. Okay. So, yep. And Dr. Houle can talk about pregnancy and older.
Yeah.
Okay.
Yeah, so we don't immunize until 2 months of age. So most of the hospitalizations on babies are either babies that aren't eligible to be immunized yet, so they're less than 2 months old, or haven't been immunized. So what we encourage is mothers in the third trimester of pregnancy, usually around 28 weeks of pregnancy, we will give them a tetanus booster with each pregnancy because it's got pertussis in it.
Okay.
And that booster will cover those antibodies that mom makes with that booster will cross the placenta and protect baby until that 2-month shot. That's the same reason that we encourage people to get influenza vaccine during pregnancy at the end. And we actually can offer RSV vaccine for pregnant women also if they're going to deliver during RSV season. So that is one way that the pregnant mother can protect baby. And I've seen things on the internet where they're saying babies get in utero injections. We do not stick needles in moms' bellies and inject babies. We encourage mothers to have the Tdap to protect that baby.
Okay.
And so that is something that you can do. And then at the 2-month time, we really encourage the DTaP, the diphtheria, tetanus, pertussis vaccine, because those are illnesses we don't see. Tara has all kinds of statistics, or Tara, I'm sorry, all kinds of statistics from the state on what's happening now, because it's not good.
Yeah. And with adults, too, as obviously there's some that just don't want to come into the clinic. They're just going to rough it at home, venture out, probably suggesting masks, probably with somebody that has a constant cough or...
If you have a constant cough, I suggest you stay home or go to the clinic and be tested and treated.
Okay.
Because this is contagious for 21 days, and it lives on surfaces for 2 to 5 days.
Oh.
It doesn't just go away. So you
Okay.
can cough in the bathroom at school, and then for 5 days, people can pick up your germs.
Oh.
So, and it does pass by cough.
Okay. Yeah.
So
Yeah.
we don't.
And we've always seen those videos of like the sneezes and the coughs, the slow-mo, just like, ooh.
Yeah.
Yeah, let's
It's
not watch that
everywhere.
anymore. Yeah, it's everywhere, that's for sure. So,
Yeah. So that's, I mean, those are really the biggest things. If you want to protect your family, your children, the best thing you can do is be immunized during pregnancy if you're expecting a baby, and then doing those immunizations. You and I, all of us grew up in an era where everybody immunized. We didn't see those diseases, and I
Right.
think people have this idea, it's not real, it's not around. It's not around because we're immunized.
right.
That's why it's not passing through the community.
Yeah, true. Okay.
So, okay.
Okay, what did...
Can I say one
Yep,
more thing?
go ahead.
Just a reminder that you can still get whooping cough with getting the vaccine, but it is less severe, less hospitalizations in infants, and complications secondary to this. Your immunity kind of weans from it, and that's why we do those boosters early on to build up their immunity, and that's why we do that extra, the Tdap at 11 or 12 years of age. And we also highly recommend that if grandparents are going to be around young babies, that they should also get their Tdap updated, and also the fathers of the children.
Okay. All right. Tara, good morning.
Good morning. This is the highest incidence of pertussis that we have seen since 2012. Just this year, 2024, or in 2024, we had 150 cases just in North Dakota. Right now, we're seeing a biggest concentration of this over on the eastern side of the state. But in Adams and Hettinger County, we've had 10 cases between the two counties reported. Now, so it's here. The thing I want to stress is for vaccinations, if you are seeking a tetanus vaccine with the pertussis component, you have a lot of different options. You can go into the clinic, you can go into the pharmacy, you can come to public health. All of these entities will immunize, and regardless of insurance status, you can get the vaccine. We even offer vaccines free of charge all the way up into that senior population through public health. So you don't have insurance, you can still get the vaccine. Almost all the insurance companies right now are paying for recommended vaccines. So if it is options, to come and get that vaccine, don't hesitate just for financial reasons. There's a lot of places that can help support that.
And with this, you could call the clinic up if you don't know if you have the right shots. Everything's on file, and just to make sure you're covered, right?
Absolutely. Any provider that administers any kind of vaccine has access to the database that can look that up and see where you're at. A lot of our adults are lax in this particular vaccine because, like Dr. Carey said, you get that shot when you're in junior high, and if you're having a baby or if you're a provider or grandparent, but there's a lot of us that don't get up to date on that until you get cut. Oh boy, now I need a tetanus shot, throw in the pertussis component.
Yeah.
So we have a lot of healthy adults that are not up to date.
So if you could still have had the tetanus but not have the pertussis in it, is that what I'm...
Yeah.
Okay.
There are a few adults, especially older adults, that for a long time we just did a TD. That was just tetanus. So somebody who had a cut, they needed that, we would just do the TD. And it's just been more recently that they recommend everybody have a Tdap, get that pertussis booster with every shot. But you can do it. Some Medicare plans do not cover that immunization at the clinic, but we encourage people to go to public health or to the drugstore to get it because it is paid on their Part D plans.
Oh, okay. Gotcha. Okay. All right. Anything else from Tara? Okay.
I
Thank you, Tara.
Just another important thing, if you are sick, important that you guys are washing your hands, you're coughing into, your elbow, or coughing into a Kleenex or something like that, and washing your hands frequently. Also, if you're sick, stay away from the babies, the young ones who aren't especially immunized, those especially under a year who aren't fully immunized, because they're at the highest risk of getting sick and having serious complications from this. Other things that currently are going around in our community is COVID. We have influenza A going around. We have RSV going around. That's all in our daycares, along with also now dealing with whooping cough. So there's a lot of things going on, and there's vaccines that can help prevent the severity of these diseases.
Yeah, a little bit of everything here in Hettinger. Yeah.
Yeah, and Dr. Carey doesn't have as many hospitalized patients as I do. Lucky her.
Yeah.
But we have hospitalized people for all of these illnesses except pertussis in this community. But there have been infants hospitalized in the state, and at least one has been on a ventilator.
Oh,
So it's not anything to mess around. Yeah, and ECMO, which is what they used to do for COVID. So that baby's lungs were so bad they had to put them on bypass and allow a machine to oxygenate their blood.
Wow.
So it's not something to mess with, especially in those teeny tinies.
Yeah. So if you're feeling under the weather, doesn't hurt to just run up there. And now, do you guys will you do the same thing as you do the flu shots outside? Do you if you call up?
Tdap, you can just schedule an appointment for an immunization. Yeah, you don't have to do the drive-through. I suppose if you don't want to come in the clinic and you want to do a drive-through.
But if you're hacking and all this stuff, maybe.
At that point, the immunization isn't as important as being treated. And then after you're treated, come on in and get the immunization, because having pertussis doesn't necessarily give you long-term immunity against it.
Okay. And now on the Tdap, how long is that good for? Year, like 5 years, 1 year?
It's good for 10 is the recommended
10?
routine. However, if there's an outbreak and you're beyond 5 or 6 years, I would go ahead and get an update.
Okay. Okay.
One more thing. The other thing is if you have been exposed to pertussis or whooping cough, then please contact your provider, because there is prophylactic medication that we can go ahead and treat that with. I think that the school has sent out a letter, or they posted on their Facebook page about whooping cough that the state of North Dakota has put out.
So we're kind of going back to the close contact type of stuff. So.
And I just want to piggyback on the symptoms. In your individuals that have been vaccinated that do come down or get diagnosed with pertussis, you're going to be seeing a little bit different symptoms. It's not that strong whoop that we usually see. It's a lot more of the asthmatic kind of labored breathing, shortness of breath. So a lot of folks are just thinking that their littles are having an asthma attack or struggling.
And do you feel it in your lungs and all that? I mean,
the heaviness and the shortness of breath, yeah.
Okay.
So if you think, well, I don't need to go in because we don't have that whoop, we don't have that labored cough, we're not having the vomiting afterwards. If you or your children are vaccinated and you're seeing those asthma-like symptoms linger, that could be pertussis presenting in the vaccinated community.
Okay.
Yeah, I think another thing with pertussis, if you have had an exposure, if we test someone and they're positive, the state health department does contact tracing. So they'll be contacting the home, who has your child been exposed to. We'll treat everyone who lives in the home, and then beyond that, there are different decisions made about
So
who
if it comes
needs
to,
prophylaxis.
I had 15 people in my classroom. Then you're
Yeah. So if your child was in the classroom,
or
they'll try to
walking the
figure
halls.
out. Yep, they'll try to figure out who all they were exposed to. Try to contact those people, see if they have symptoms, see if they're immunized, and then try to help them figure out: do you need to be immunized? Do you need to have prophylaxis? Do you need to
Yeah.
watch for symptoms?
Okay.
So if you're contacted by the state, please don't ignore that call. They're trying to protect your family.
Yeah, definitely. So, okay. Anything else this morning then with that? All right. Well, appreciate you guys coming in. Thank you.
Thanks.